Hi, everybody. My name's Amy. I am the MA mentor, and I'm here to help you get through those tough times when you're trying to learn about medical assisting, or if you're just a medical assistant and you need to brush up on some of your facts and skills. So we're going to go ahead and we are going to get started with some introduction to what a medical assistant does. All right, so a medical assistant is a individual who is an allied health professional, works in a variety of ways, administratively, clinically, laboratory settings. They can do a variety of things. We serve as an assistant between the providers, so the doctors, the physician assistants, the nurse practitioners, anybody who is providing care to the patients, and others, others being the patients, family members of the patients, other providers, other medical assistants, anybody that's in the room. Now, there are several medical assistant organizations out there. One is the AAMA, as it is often referred to, which stands for the American Association of Medical Assistants. That particular organization has been around for a very, very long time. And if you associate yourself with them and take their national exam, you will acquire what is called a Certified Medical Assistant Certification, or CMA. The next one is the American Medical Technician or Technologist. That's what I have. I've been associated with the AAMA as well as the AMT, but AMT currently. And if you associate yourself with them and take their national exam, you can acquire what is known as a registered medical assistant certification. The third one is the National Health Career Association, or the NHA. They are certified clinical medical assistants, or CCMAs, once you have taken their exam. And lastly, the National Center for Competency Testing, or the NCCT, will yield a National Certified Medical Assistant, or NCMA certification. Now, a lot of people ask themselves, is there one that's better? Is there one that's worse? No, there's not really. They're all the same, technically speaking. They're just different organizations. So the reason that they are called different types of certifications, certified versus registered versus national, is because they are from different certification bodies. If you called them all a CMA, for instance, a certified medical assistant, then it would be very confusing as to which organization granted that credential. So that's why they're all a little different. It's kind of like the difference between getting a CPR certification from the American Heart Association versus the Red Cross, let's say. Okay, so they're all basically the same. The tests are all basically the same. Some vary in the number of questions they ask, but for the most part, I have taken 3 of these exams myself. The AAMA, the AMT, and the NHA. And really, other than the number of questions they ask you, the questions are all basically the same. So what makes the difference really is if you're a student currently and you're in school and your school is associated with one of these particular organizations, they may have you register for and take one over the other. Otherwise, if you are not in school, you're not a student, but for whatever reason you don't have an association yet, then you can really go ahead and just explore each of them and decide which is going to be best for you. Some of them do have some eligibility requirements. Some will allow you to register for the exam if you have graduated from a program within X number of years. Some will allow you to go through an eligibility route that is based off the time you've had in field. So if you've been a medical assistant for a while, you just never got registered, They'll allow you to do that if you've worked, say, 3 of the last 5 years as a medical assistant. Each one is different, and you can just go in to any of your search engines online, put in the name of the organization, and pop right up, and you can research that. All right, next, what are the general duties of an MA? Well, communication is key, not just to our patients, but to our providers, to each other, to other facilities, nurses, lab technicians. It goes on and on and on. This communication can be either verbally, non-verbally, written, or through electronic means. We do a lot through electronic health records, and we can communicate through those as well as, just your typical electronic means like email and things like that. We provide patient education, and patient education is primarily explaining to the patients a little bit more clearly, and sometimes a little bit more layman terms versus technical terms, regarding what the doctor or the provider has decided they want them to do, educating them on various diets, for instance, how to take medications, what type of side effects to possibly expect from medications. Say they're getting prepared for some type of procedure. We can educate them on how to prepare for that. If they're going to have to do anything at home, like say they had an injury, where they're going to have to change bandages at home or something like that. That's all part of patient education. And that's really, really important for our patients. Otherwise, they just don't know what to do. And then, of course, we act as a patient advocate too, meaning that we can help our patients. Say, just as an example, your patient is elderly, they're not able to possibly pay for the medication that the provider is wanting them to take. Maybe they're on Medicare and it doesn't cover or something like that. We can advocate for our patients sometimes and maybe find other programs or things that they can get onto to help them with the cost of that. So patient advocacy is a huge, huge part of what we do. Administrative duties. We maintain medical records. We greet patients. Sometimes we do appointment scheduling, telephone communications, billing, possibly insurance processing or authorizations, and transcription or scribing. So here's what makes an MA very, very different than a lot of the other health professionals out there. Like when you think of, LPNs or RNs or anybody else that you might encounter in, some kind of clinic setting. We are trained not only in a clinical setting, but also in an administrative capacity. Now, not all of us work in that administrative capacity necessarily. A lot of us like to be clinical, hands-on, get your hands dirty and get in there. However, some people do prefer the administrative end, and that is absolutely okay. But then there's those of us who do both. So it makes us very, very valuable to be trained in both and to understand how to do both. Because let's say, you're a clinical MA and you're in the back most of the time, but then one of the girls in the front calls in sick or has to go home sick. You are able to jump in and help, unlike some of the other healthcare professions. Clinical and laboratory duties that we undertake as well. And this is probably the bulk of our responsibilities. Assisting with the providers, of course, exams, procedures, things like that. Infection control, making sure that everything is sterilized as it should be or sanitized as it should be, to keep and prevent the spread of disease. We do EKGs or electrocardiograms, injections, different types of medication administration, including injections, and vaccines. Phlebotomy, which is drawing blood. Not all MAs engage in phlebotomy, but we are trained to do it. and can do it if we need to. Point of care testing, or POCT. Point of care testing is any type of testing that is bedside and what they call CLIA waived, or very, very simple types of testing. These can be rapid strep tests. These can be blood glucose tests. There's various point of care tests out there that we are able to do. And I do talk about those in other videos. Vital signs. Vital signs are probably one of the biggest responsibilities we have. These are things that we do with every patient on every visit and do what seems like a million times a day, but these are temperature readings, blood pressures, pulse rates, respiration rates, all the way to height and weight, okay? All vital signs. We can remove sutures. Sutures are stitches, of course. We can sterilize medical instruments, collect specimens, room patients, and these are just a few of the things that we do, depending on our setting, of course. Our scope of practice, what scope of practice means is basically the skills, procedures, and processes that we are able to perform, that we are allowed to perform under our training and our certification. Each state is very different in how they regulate these things. Some states are very kind of ambiguous about scope of practice for medical assistants, where they basically say, of course, in way more legal jargon than I'm about to expunge, but they usually will basically just say if the provider's okay with it, then we're okay with it. Some states are very, very specific. The state I live in is incredibly specific. It is spelled out in our regulations exactly what an MA can do, what an MA can't do. And some of the things that we're actually allowed to do, we've not even really taught to do, unbelievably enough, only in very specific settings and on the job. But we do have to adhere to our scope of practice anywhere that we are. Because if we go outside of our scope of practice, then there can be legal ramifications to that. So always just check what your scope of practice is in your state. And you can usually just get on a internet search engine and look up scope of practice for medical assistants for, fill in the blank state. And it should lead you to, ours is through the Department of Health here. Sometimes it's through a Department of Health, sometimes it's through the medical association in the state. It just really depends. But it should lead you to a place where you can find that scope of practice. As I had explained a little bit ago, what we do and how many skills we use on a day-to-day basis really depends on the specialty that we are in. And we can be in very kind of generalized primary care settings, or we can be in very highly specialized settings, and we can work in both of these. So these are just a few to kind of wet your whistle, so to speak. Allergy and immunology, cardiology, of course, having to do with the heart. Dermatology is the skin. Endocrinology has to do with the body system that produces hormones and regulates hormones. So in endocrinology, you see a lot of patients with, say, diabetes, thyroid issues, things like that. Family practice or primary care. This is where I spent the majority of my career. You see a little bit of everything. I always joked that a primary care or family medicine doctor was the jack of all trades and the master of none. They can do pretty much a little bit of everything on a basic level. When it gets to be too much, that's when they have to send them out to a specialist. But this is a doctor you go to see generally for, if you've got a cold or something like that, or you have something going on and you're not sure what it is, and you just need a diagnosis and then some type of plan after that. I really enjoyed primary care pretty much because I was able as a brand new MA, to learn a little bit about every kind of condition out there. We saw a lot of different patients. So I always say it's a good place for a new MA to start. Gastroenterology, of course, is the the GI gastrointestinal system, stomach, intestines, really anything having to do with those. Internal medicine. So internal medicine, people get a little confused about internal medicine. What that is it's primary care. However, they do not see children. It's only for adults. So the difference between primary care, say family medicine, and internal medicine, they do the same things, they treat the same things. It's just internal medicine doctors only see patients over the age of 18. Nephrology, that is the study of the kidneys. Neurology, of course, is the brain and the nervous system. OBGYNs are baby doctors, and women's reproductive health. You can work for just a GYN. I did that for a bit. We didn't do pregnancy. We just did women's health. Most doctors, most gynecologists do have an OB background, but many after a while choose just to practice in gynecology only. I think, don't quote me, but I think it has to do with the malpractice insurance. Oncology is the study of and the treatment of cancer. This is a very specialized specialty out there. It takes a very strong person to work in oncology. You have to really, really, really be strong emotionally, because you are going to lose patients. You're going to have patients that are going to pass away. There's no if, ands, or wins or anything like that. It's going to happen. So oncology is not for everyone. All of these are not for everyone. You have to kind of really find where your niche is in the medical field. And sometimes that takes a bit. I was very lucky that I found my niche like right off the bat, starting out with family medicine. But, sometimes it takes a minute. It takes a minute to really figure out what you like and what you don't like. Ophthalmology is, of course, seeing the eyes. Big difference between ophthalmology and optometry. So an ophthalmologist is a medical doctor. They have trained just as every other medical doctor has. They just chose to specialize in the care of the eyes, not just vision per se, but disease and injury. Where an optometrist has what basically amounts to a doctorate, an advanced degree. However, they didn't go through medical school. They just went through school to be an optometrist, and they deal primarily with just vision, like the doctor you go to get your glasses from. Orthopedics is muscles, bones, tendons, ligaments, musculoskeletal system. Otorhinolaryngology, or otherwise known as an ENT, an ears, nose, and throat doctor. They deal a lot with just those, the ears, nose, and the throat. Pediatrics, of course, is primary care for children. Anybody I think they actually take under the age of 21 in some states now. Although I don't know many 21-year-olds that still want to go see a pediatrician. I know when I was young, I think I stopped when I was about 13 or 14. I know my kids didn't want to go see a baby doctor anymore after about that age either. So, but pediatrics, if you really like kids, it's a good place to go. Physiatry. Physiatry is a very highly specialized area where they deal with a little bit of everything, but on a specialty level, if that makes sense. So, some neurological issues, some musculoskeletal issues, just more of the, I call them the head scratchers for other doctors when things are not really apparent as to what's going on. They may send somebody to a physiatrist. Podiatry is care of the feet. Some people don't like this. I'm well aware some people hate feet. Just don't go into podiatry because you're going to see them every single day. And you'll probably have to touch them too. And then urology, of course, is having to deal with the urinary system. Urology also serves as reproductive health for men. Men do not have their own reproductive health providers like women do. So anytime anything goes wrong with reproductive issues for men, they go to see a urologist. All right, moving on. Other opportunities as an MA, you can be a billing and insurance person, a compliance officer, medical biller and coding or coder. That takes a little extra um, I don't want to say training, it's not a huge amount of training. A lot of people really pick up on that sometimes just by exposure. Um, but if you want to get certified as a coder, you probably would have to go through a program for that because it's not the easiest thing in the world. You do learn that in your medical assisting training though, on what I call a baby MA level. But it is something that's very useful. And God forbid you ever were to get physically injured, or, when you get older and you just start to slow down and don't really want to run around like a crazy person anymore. Billing and coding is not a bad way to go. You can stay in the medical field and not have to, be too physical. Medical scribe, that's a huge thing now. So if you know what transcription is, transcription was a thing that's been around for a very long time, where the providers would record into like a little recorder, tape recorder, all of their notes when they were seeing a patient, and then a transcript. Those recordings would go to a transcriptionist, and they would type them all up for them. That is starting to go a little by the wayside. There's still transcriptionists out there, and it's still a thing, but that's starting to go a little more by the wayside because many providers, especially ones in hospitals, are now wanting to have their transcription done in real time. And that's what a scribe is. If you've ever been you see them primarily in hospitals. If you've ever been in a hospital and you see the person kind of running around behind the doctor with a laptop or a computer on a rolly cart, that's a scribe. They're basically typing out everything the doctor's saying in real time. So to be a scribe, you have to really know your medical terminology, which, as an MA we do, and you have to be able to type really fast, which I can't do that. So scribing would not be for me. Phlebotomist, you can go and be just a phlebotomist, just draw blood. Some states, I know my state, you have to have a separate certification for that. Some you do not. Again, it depends on the scope of practice in the state. And many MAs, as they go through their career, become medical office managers. It's kind of a logical progression. You start out as an MA in the office, and if you build up enough time and have the wherewithal to do it, you could be managing the office at some point. All right, so that is just kind of the basic overview of what an MA is and what we do. I am the MA mentor, and I will see you next time. Thank you so much.